Hi, good morning. How are you?
Good, I'm good. How are you?
I'm good, thank you. How are you feeling today?
I'm a little bit nervous but excited.
Oh,
Uh,
that's good.
yeah. Um, so my name is Filiz, and I'm here to answer the interview questions.
My name is Lyra. I'm one of the interview panelists here, and good luck to you.
Thank you.
Okay, so let's start. So I'm gonna give you three questions,
hmm
and you have time to answer that. So first question, considering the NMBA standards for practice that govern your nursing practice, how will you deal with the following situation? It is your first rotation as a new graduate nurse. You responded to a patient call. When entering the room, you noticed that one of your patients was having difficulties breathing and another refused patient was trying to climb out of bed. How would you handle this situation? Reflect on how you would handle the stress of the job.
So as a new graduate nurse, I'll be sure to follow my standards of practice in this situation. According to the NMBA standards for practice 1.4, nurses are to comply with legislation, common law, policies, guidelines, and other standards or requirements relevant to the context of practice when making decisions, as well as the standard 1.5. Nurses use ethical frameworks when making decisions. So when answering the patient call and upon entering the room, I'll be sure to call out for another nurse's assistance. I'll be sure to attend to the patient having breathing difficulties, while my colleague attends to the confused patient. For the patient having breathing difficulties, I'll be sure to sit them up and apply oxygen to assist their breathing. I will also be reassuring the patient to remain calm, as well as making sure the confused patient and my colleague are safe. Um, I will reflect on the stress of the job. Um, sorry, my reflection on the stress of the job would be making sure I had followed my nursing standards, as well as making time, taking time off from nursing responsibilities, and have some self care time. I would also use the self care time to reflect on the situation and prioritize what can be done better next time to ensure safe and effective nursing care is being applied.
Good.
Thank you.
Okay. So, question number two, nurses have to comply with occupational health and safety standards. Describe a time that you had to deal with an unsafe situation and how did you handle that?
So, as a student nurse, I understand and always do my best to comply with the occupational health and safety standards for myself, my other healthcare workers, and patients. An unsafe situation I have experienced would be when I was on my PP4 placement and I was paired with an RN that had patient medications due and had allowed me to assist them with the preparation of the medications. I was given the task of drawing up 10 mils of sodium chloride in a 10 mil syringe. I had taken all the essentials needed and had attached the drawing up needle to the syringe as I was ready to draw up the sodium chloride. Um, but the RN had stopped me and said, don't use a drawing up needle, just attach the syringe to the sodium chloride ampule and draw it up. I had told the RN that this is how I had been taught to draw up medications from uni. However, the RN had refused and said, no, don't use it. So as I was about to do as the RN told me, my facilitator had walked in the medication room and told me to leave it and the RN can do it that way. And I was told to just stick to what I have been taught from the uni. I have reflected on this situation, and if I was put in that situation as a new graduate nurse again, I'll be sure to follow my nursing standards for occupational health and safety for myself as well as the patients.
Number three, the completion of your bachelor's degree is only the foundation of your development as a professional nurse. Ahead of you there is a lifelong of learning and autonomy. After obtaining employment, what is your long-term career plan or commitment to professional development?
So after obtaining my employment, I'll be sure to always comply with the NMBA standards for practice and code of ethics throughout my nursing career in all areas I have achieved. According to standards 5.2, according to standard 5.2, nurses are to collaboratively construct nursing practice plans until contingencies, option priorities, goals, the actions, the outcomes, and timeframes are agreed with the relevant persons. This standard for practice for nurses will be the standard that will push me to perform further motivation to further improve my development in skills and knowledge to be an efficient nurse in all areas throughout my nursing career. I believe that also talking with educators and senior nurses throughout my career would also help with my future goals of developing a more professional persona for my long-term nursing development. I'll be sure to reflect on what has been achieved, what could have been done better to improve my nursing skills, and what I'll have to do to achieve my knowledge at the end of every shift to better my understanding and abilities to perform as a professional nurse.
Thank you, Filiz, for taking your time to attend the interview today. I wish you all the best in your future career.
Thank you for your time as well for interviewing me, Lyra. Have a good day.
You too.
Thank you.